Special Populations in Exercise and Sports, Chapter 27. Individuals with spinal cord injuries, spina bifida, post-polio paralysis, and/or amputations may utilize a wheelchair to participate in many exercise and sport-related activities, including track, road racing, basketball, tennis, field events, bowling, archery, slalom skiing, table tennis, swimming, and many other sports and activities. Common injuries to wheelchair athletes include muscular injuries, sprains, strains, inflammation, blisters, laceration, abrasion, skin cuts, pressure sores, arthritis and joint disorders, fractures, and hand weakness or numbness. Environmental considerations are more likely to occur in wheelchair athletes, including heat illness and hypothermia. When nerve disruption occurs, there could be a decrease in sweating, which may affect thermoregulation. Bladder dysfunction may occur with individuals who have a neurogenic bladder, including conditions such as bladder infections, incomplete bladder emptying, bladder stones, and bladder obstructions. It is important that wheelchair athletes drink a large amount of fluid to keep the bladder healthy. Orthostatic hypertension is caused by prolonged sitting or sudden or rapid shifts in body position. This results from the inability of the sympathetic nervous system to adjust to rapid changes in body position. Individuals with orthostatic hypertension will feel lightheaded or feel faint. Many wheelchair athletes take a variety of medications for infection, abnormal muscle tone, seizures, or other neurological conditions. It is important to be alert for drug reactions. The most common issue for all athletes with amputation is irritation at the junction of the amputated limb and the prosthetic device. This is more of an issue with the lower extremity because of weight-bearing forces. Due to the lack of sensation, initial irritation may go unnoticed. Look for redness, skin irritation, and occasional swelling. Infections can lead to potentially serious complications. Cerebral palsy involves uncontrolled muscle spasticity, which can range from mild to severe. Because of the increased load on the musculotendinous units as a result of the continuous muscle contractions and limitations in joint range of motion, muscle strains are common injuries. Sports participants with visual impairments have issues with unseen barriers. Not being able to see can make navigating road surface conditions, walls, curbs, and other competitors difficult, as the person lacks the visual cues that others take for granted. Marla Runyon is a legally blind marathon runner. Marla Runyon has won 3 national championships in the women's 5,000 meters. Most notably, she became the first legally blind athlete to participate in the Olympics in the 2000 Sydney Olympics, where she placed 8th in the 1500 meter, the highest finish by an American woman at that event. On May 25, 2001, Eric Wallenheimer became the first blind person to reach the summit of Mount Everest, an achievement which was profiled in Time magazine and covered in his autobiography, Touch the Top of the World, A Blind Man's Journey to Climb Further Than the Eye Can See. Eric maintains an active lifestyle as an acrobat skydiver, long-term distance biker, marathon runner, skier, mountaineer, ice climber, and rock climber. Paralympic Hall of Fame swimmer Tricia Zorn is a U.S. swimmer who has been blind since birth. Most notably, she has won 55 medals, 41 gold, 9 silver, and 5 bronze, making her the most successful athlete in the history of the Paralympic Games. Craig McFarland lost his vision at age 2.5 due to a welding accident. His athletic instinct kicked in at an early age, and by the age of 8, he had won his first wrestling tournament. Inspired by this achievement, Craig went on to compete in a wide variety of sports and earned a whopping 103 gold medals in wrestling, track and field, swimming, snow skiing, water skiing, and golfing. Growing up, Craig Osgood was always active in sports. Upon losing his sight at age 16, he turned to sports as a way to regain his confidence and independence. Craig has now participated in 7 triathlons and has completed a bicycle trek across Canada. Many other notable blind and visually impaired athletes exist. These are just a few of the examples. It is estimated that 60% of adults aged 65 and older participate in physical activity. The aging process plays a major role in skeletal and neuromuscular function. Muscular injuries can occur more frequently in the older adult. Aging decreases the density of collagen, which lowers tissue elasticity.